being in practice over 20 years and treating a lot of injuries on athletes as well as just general patients, sooner or later, when you start a workout, a running program, you pick up tennis, golf, injuries will occur. So the question is, okay, what do I do when I first get injured? That's a question that a lot of patients have. They're not really sure, should I put ice on it? Should I put heat on it? Should I continue to play? Should I work through the pain? And one of the biggest misconceptions is work through the pain. Well, guess what? If you're a runner and you twist your ankle, don't continue to work through the pain. If you're having knee problems, hip problems, shoulder, elbow, wrist, do not continue to work through the pain. So what should I do? Well, everybody's kind of heard of the old adage RICE, which means rest, ice, compress, and elevate. It's extremely important that you abide by this. Types of injuries, whether you're at home, whether you step off a stair, whether you're running down a track, or whether you're following through with a tennis shot and you get an injury, the initial step is very similar or almost identical. So, one is you want to ice. Okay? It's extremely important that you ice, that you, secondly, get off of it. If you're standing on your foot, your hip, your ankle, the thing you want to do is, one, sit down, stay off it. If it's your shoulder, your elbow, or your wrist, you want to bring it close to your body and keep the weight off of it. Keep it elevated. Okay? Now, patients say, okay, doc, I shouldn't heat. Well, what do I need to do? I go home, I can't get to my doctor, I can't get to the hospital, I can't get to the emergency room, I'm not sure what's going on. Well, one, as we said, stop doing the activity that you're doing. Don't continue to play like patients tell me. I was golfing, doc, threw my hip out on the second hole, and it was hard to walk, and my question to them is, what'd you do? They stated, I continued to play. Well, you don't want to continue to play. You want to stop your play. You want to stay off of the joint, whether it's your ankle, your knee, or your hip, even if it's the shoulder or the low back. Second is you want to be able to ice. Several different ways to ice, and that's going to be kind of critical based on the area of the body you're icing. Okay? One, if you don't have a gel pack like this, then we recommend if you're home and you have a bag of frozen peas or frozen vegetables, you utilize that. Okay? You put it over the area. But before you put it over the area, you want to put a towel, or sometimes a towel doesn't allow enough cold. You put something like a t-shirt, and you put that area, say on the t-shirt, you put that down on the shoulder if it's a shoulder injury, and then you put the ice on top. Okay? You never lay on the ice, because then you'll be compressing the joint which is swollen. Now, back to the joint that we're dealing with. If you're dealing with a swollen ankle, for instance, I've seen ankles which were extremely swollen. I just knew if I took an x-ray of it, it's going to be broke, and it wasn't. Or I saw ankles that had very little swelling. If I took an x-ray of it, I thought it would be fine. But we rule it out, and in cases, there is a fracture. So never try to determine that for yourself without seeing your physician. That's why it's critical. It's very difficult to determine whether you actually broke something in an extremity or not. So always assume you want to stop playing and you want to put the ice on. Now, there's other ways to ice. The other way is you get a bucket full of water with ice in it. You can submerge your ankle in it till you feel it, which is very effective, but you can't keep it in there for a good length of time, which we're going to get into in a second. Then you want to always make sure you elevate it. How do you elevate? Well, and what is the purpose of elevation? One is elevation is to allow gravity to help you pull that inflammation and fluid out of the joint. By elevating it, the inflammation will go down towards the ground. So, you can use the vegetables. You can use gel. You can use water with ice. Okay? If you don't have any of those, but you have a Ziploc with ice, and it's of an area where you can't put it underwater, what you want to do is you want to put ice in it, a little bit of water, put a Ziploc, always put something on the skin so you don't freeze or burn your skin. You don't get the ice burn. You want to put a t-shirt or a towel on top of that area, and then the ice on top. You never want to compress or put pressure against another surface and that ice, which will cause more of an irritation to it. Okay? You want to keep that extremity with as little motion and a little pressure on it other than the ice. Now, how long should I ice, Doc? Well, you want to do 10 to 15 minutes at a session, because ice over 15 minutes or longer can become an irritant to the area. So you want to be able to do 10 minutes, 15 minutes on, 10 to 15 minutes off, and you want to continue that cycle for several hours. Now, if you have other things to do or you can't continue the ice that often, then you want to do in blocks of half hours. 10 on, 10 off, 10 on's a half hour. Do that for a couple hours throughout the day using half-hour blocks. So when you're off the extremity, that's one thing, by staying. Second is you want to put a piece of towel, the ice on top, and you want to make sure it's elevated to get that inflammation down. You want to always decrease the inflammation as much as you possibly can. Determining on your own whether I tore something, whether I just strained a muscle, whether I hurt my back, or it's a disc herniation or a fracture, is not up to you. It's up to your physician. Your chiropractor can help you with that, walk you through it, and explain. The history you give him when you go in is extremely important. If you've ever had a fracture before, if you ever had injury to that area before, if you're an athlete just starting to train, if you're a seasoned athlete and you understand what you've done and how many times this possibly has happened before, all of that information helps the physician, even if it's on the phone, before he sees you, to give you better advice. So initially, when you first get hurt, the rule is first 72 hours, you want to ice. Second is you stay off of it. Third is you don't want to ice more than 10 to 15 minutes at a time. And the next is to make sure you get in and see your physician. Patients will say, well, I can put this Bengay on, or I can put BioFreeze on, or I can put these types of gels and this icy hot and so forth. Not mentioning product names, but overall, ice by itself is the best thing you can do, because it works as a pain reliever, it reduces the inflammation, which that's why you don't want heat, because heat will create inflammation, okay? And you want to stay off it. The gels, the creams, and so forth aren't necessarily something I recommend to patients in the first 72 hours because it may mask it, but ice is going to give your physician the best type of scenario. If you go in saying, I've iced it the last 24 hours, then you're going to get the best results. So, one, you want to make sure you call your chiropractor, get the best advice, get in to see him, and use something to help support your weight when you're getting in there, like crutches or a cane, if it's an ankle or a knee problem. So, thank you for your time. Have a great day.